Okay. And then I just give it a little bit more. Good, scoot down a little bit. Good, awesome. Hey everybody, it's Dr. Tiffany from Sioux Chiropractic, and today I get to adjust Kara. She is 28 weeks pregnant with twins. At this point in her pregnancy, especially with twins, my job is to keep her comfortable, keep her pain away. I want her sleeping. The better she sleeps, the longer, obviously, she's going to be able to stay pregnant, just because she can grow those babies and sleep well and really just get through the day. So I've been working on her with headaches and also obviously low back pain. So when she sleeps on her sides, it's just a lot of weight on her pelvis to get comfortable. So she's always a little better after the adjustment. And then about a week out, she's ready again at this point, okay? So she's working with her OB team. The longer we can keep her comfortable, the longer they get to keep her pregnant and keep those babies growing. So we're gonna do her adjustment today. And yeah, all right, go ahead and stand right here for me, Kara. Okay. And we're gonna go through your ranges of motion, okay? So you can have your feet apart a little bit if that's more comfortable. And I want you to see as far as you can go to touch your toes. Good. Any pain in your low back with that?
Nope.
Good, okay, come on up. Arms up. I want you to follow them as far back as you can go.
Without falling over?
Yes, without falling over. Perfect. Good. Come on up. Any pain?
Not as much. A little in my neck, a little on my spine.
Okay. Let's do this rotation of your whole back. So rotate all the way over one shoulder for me.
Good. On the right side.
On the right side. Good. Other side?
Same right side.
Same right-sided pain. All right. Let's go ahead and move your cervical spine. So let's look all the way over one shoulder.
That's okay.
Okay. Other way?
Upper right neck.
Upper right, like right under that skull, right at that occiput spot, yep. Okay? Chin as far down as you can go. Good.
Nothing.
Nothing. Awesome. All the way up.
Nothing.
Beautiful. You ready to do this? All right, let's go. All right, Madison, you can back up just a little bit. So I'm going to prep my table. So we give her a safe place for those babies to go and then climb on up. This is the fun part. Good luck. Her athletic event of the day. There we go. Good. How's that feel?
Good.
Good. So as long as there's enough cushion, she's not feeling any hard table right where her babies are, we're good to go. She's comfortable. This is probably your favorite spot you've been in all day. Where do you feel that?
My hips more.
Both hips? Okay. Any pain?
No.
Good. Any pain?
No.
Good. Anything?
Little in my hip.
Which one?
Yep.
Okay.
Yep,
That's it?
that's it.
All right. Just center you on the table a little bit. So what I was just testing for is internal and external rotation of her hips, as well as extension. So whenever I have a very pregnant mama like this, it's really important. Kara, let me know if you need to get up and take a breath, okay? It's usually a really comfortable position for them to breathe, right? That baby's finally like working with gravity out of her spine. And then I'll try and adjust as much as I can in this position so we don't have to get her up and moving and flipping a whole bunch. Good. So we're going to do the SI joints in this position, and then I am going to get her on her back to get that hip in the, that was internal rotation, right? I'm sorry. So I'm palpating her low back while we're here too. There we go. So I'm going to use my drop table so I can just set this tension as low as I can with her body weight, and then it'll fall underneath me with just a little bit of pressure. There we go. Good. So I'm testing rotation at her cervical thoracic junction right here, and she's pretty locked right here. On this right side, breathe in, breathe out. Awesome. And And same with just normal extension through this thoracic spine. Obviously her center of gravity is way off. So all these paraspinal muscles, all these stabilizers, they're really working overtime to try and hold her upright even, right? She has two people in the front of her that her body's trying to hold up. So she's got some rigidity in this spine as a result and some really tight muscles. When's the last time you had a massage?
Too long.
Too long. She's usually pretty good. A couple weeks? Mm-hmm. Yeah. You know what? I'm going to keep this like this. Breathe in. Breathe out. Good. Awesome. And while I'm here, I always scan for these ribs too, because that gravity is really going to pull shoulders forward, and sometimes that creates some rigidity in the thoracic spine and as well as the ribs that connect there. Good. Breathe in. Breathe out. Good. So I'm at her L5 vertebra here. She's got a lot of rotation here, as well as decreased extension on this left SI joint. So we'll adjust those two spots separately. And I just use my drop table. Just give it a little bit on top of what her body weight would take to drop that. I can always add more resistance to my table, which will require me to give it a little bit more. But usually pregnant women adjust so easily. They have relaxin hormone. And it doesn't take much. So we never want to do too much. I could always add more. We're down on the sacrum. Good. Any pain with that?
Yep.
Yep, pretty tender?
Mm-hmm.
Sorry.
Okay.
Is that one better?
Mm-hmm.
Good. Good. Okay, let's just see how this feels. Pretty tight?
Mm-hmm.
Good. This way still tight?
Not painful though.
Not painful though. Good. Is this still tight?
A little.
A little bit? Okay. And this was the kicker. How's that?
Much better.
Much better? Okay. And we didn't even work on that hip internal rotation yet. All right, so we're going to come in here and I'm going to test this hip again. Any pain bringing it up?
Mm.
Good. What about here? Nope. What about here?
Nope.
Good. All right, we're going to bring both knees up. And this is my kind of general scan for the pubic bone. Open. Squeeze hard. Where's the pain?
Left side.
Left side right in there. Mm-hmm. Okay, so I'm always working on the outside of the body, but the pubic bone, which is right at the front of the pelvis here, has a lot of really big muscles that attach to it. So with pregnancy, naturally your pelvic floor starts to go, which gives a little bit more shift into this pubic bone. So I'm going to come in and I'm just palpating right along where the swimsuit would go. And she'll tell you it's a tender area. Mm-hmm. So I'm always on the outside of the body, right in this crease. And I'm going to use my clicky just because she doesn't have a lot of room for me to adjust this manually. And this allows me to just adjust really quickly and get in and get out into this sensitive area. Whew. You okay? Mm-hmm. Tender?
Yep.
So I'm still palpating before I adjust there, but what that does is it's really quick. So mass times velocity is force. So my hands are really slow, but there's not a lot of velocity to them, but there's a lot of mass behind my manual adjustment versus that clicky. It's really quick, but it's not a lot of mass behind it. So it still can give a decent amount of force without having to have my whole body weight against it. Squeeze hard. Better, worse, or the same?
Better.
Better, what % better?
40?
40, good. I'll take that. All right, so same thing. Just set my drop table. I'm going to make this really comfortable for her. There's a lot of baby here, but I'm still only touching bone. So as long as I'm touching bone, really safe place to still adjust and push onto. How was that?
Good.
Good. Awesome. All right, so now we're going to adjust her lower cervicals in this position. All right, so obviously a lot of weight, a lot of forwarded shoulders with her in her pregnancy. So I always like to come down here and I check these lower cervicals, upper ribs, and see if we can't figure out Ooh. Yeah, so she's got a lower cervical that's definitely rotated and just not moving and falling away like it should whenever I challenge this and play in this joint right here. So we're gonna take all the motion she has already, and then I'm gonna take that joint to lock out into this left lateral flexion, and I'm still pushing into that joint. And then I just give it a little bit more. Okay. Did you ever wonder what I was feeling? Get a full synopsis with this video. Good. It's much better. You feel the difference? Mm-hmm. Yeah. Good. And we're going to work on this upper cervical in the chair. So come on up. Go. All right, so Kara loves this adjustment. She gets excited when I get the chair out. When we first started treating her a couple months ago, she was having headaches, which is new to her. But with pregnancy, you have times of released relaxin. And that relaxin creates a lot of ligament laxity, which means you have bones that are going to kind of shift into positions, especially after a really decent nap, right? That you normally wouldn't have. So you'll find pain that you didn't normally have, especially after those relaxin release. Your body's just allowed to kind of move a little bit more in ways it doesn't normally move. So she had, I think it was a nap that you like woke up from, and just this pain right here. So what we're going to do is have you look right and left for me. Good. Where do you feel a little more pull?
Right side.
On the right side when you're looking. When you're looking right.
Left.
When you're looking left. Okay. So we're going to come in. We're just going to feel this. Yeah, it's locked down pretty good. And I can just feel it's not gliding when I push into that left side. Do you feel that cramming? Yeah. And I feel it whenever I come back here and I motion palpate with my fingers right at the base of her skull. There's just almost like a full feeling where there should be movement. It's just not moving. That joint's not gliding like it should. I always imagine kind of a golf ball on a tee. It should kind of nice glide that occiput, and it's just not moving on her. So what I'm going to do is I'm going to have her look all the way left. Good. And then we're going to create a little bit of distraction with some lateral flexion. Good. Kick those heels out. She loves this. Good. I'm just contacting right at the base of her skull, and I'm going to move you into that rotation. Good. Scoot down a little bit. Good. Awesome. How'd it go?
Magic.
Magic. It's her favorite thing to watch on YouTube too. So I'm sure you'll just be rewatching this over and over again. Good. Now look right and left for me. How's that feel?
Good.
Good. Do you still have any resistance when you go the other way?
Yep.
Yeah.
A little bit.
She might just want this adjusted.
Yeah, I do.
We're going to go all the way right. Good. Actually, I'm going to be sit tall just a little bit so I have somewhere for you to sink to create that distraction. Good. I'm going to contact this occiput. Good. Kick those heels out. Good. And I'm right on her occiput. Good. Scoot down for me. Good. Awesome.
Oh, yeah.
Oh, yeah. All right. You're going to put your whole ear in my hand over here. So we're going to come to the C1, her first cervical vertebra on the right. I'm just going to go right, lateral flexion. Take out all the free movement she has. Good. Relax here. Good. So pregnant women, like I said, they have that relaxin hormone. So sometimes you lose that really crisp adjustment, just like in her upper back. We lose some of that noise, that audible, but that's not what I'm after. I'm after the motion anyway. Good, relax here. Good, awesome. Awesome. All right, look right and left for me.
Really good.
Good, any resistance? Awesome. All right, let's go back and let's test everything, Kara. And I'm gonna have we're gonna go through just the things that were painful, all right? Let's go through right rotation of your whole body there. Good, how's that feel?
Really good.
Really good? So you were having some pain along the right side with both of that. Good. And then we were gonna do cervical. So look all the way over one way and then the other. Good. Awesome.
Really good.
How do you feel? Yeah.
Awesome.
Awesome, perfect. All right, well, if you guys have any questions, feel free, leave comments. I love answering questions. Every woman needs to be adjusted for comfort, especially those with 2 babies in there like Kara. So thanks for watching. Feel free to leave a comment, like, and subscribe. Thank you.